Hey everybody, we decided to do our presentation on anger management. Before I get started, I want to wish everybody the best of luck. I hope everybody's healthy, clean, happy, and doing great. So I'm going to start the presentation off with a question, and that question is, do you think that anger management is a mental health disorder? So with my research, I found that anger is not technically diagnosed as a mental health disorder. It can be very severe though if not dealt with. Anger is classified as a regular, healthy, natural emotion. It is perfectly normal to feel angry when you're feeling mistreated or wronged. It can be a problem if it's too severe though. If it's occurring at a high rate, if it's lasting too long, of course, if you're harming yourself or others, then it's definitely an issue. You cannot be diagnosed with having anger as one can be diagnosed with having bipolar. Anger consumes a lot of mental energy. It disrupts your thinking process. With large quantities of this, it can cause definite mental health problems such as stress or depression. So, when talking about anger, most people label it as a bad emotion. In certain cases, it definitely can be a scary thing when dealt with in the wrong way. Um, so, when engaging somebody who has difficulty controlling their anger, it's important to allow them to be able to vent and to validate their feelings. You want to be able to remain calm in the situation and not engage them with a similar behavior. It's crucial to know when to help them and when to leave them alone. So, when engaging individuals in a group setting, an icebreaker is ideal for maximum group participation and effectiveness. Many organizations um, use icebreakers, and one in particular I found was called the answer in one word exercise. So, an example would be in one word, how do you feel um, when asked to introduce yourself in a room full of strangers? So, when asked this, it can reveal a lot about the participants. It gets the meeting started on an unrelated topic, which can kind of allow them to relax and feel comfortable. Um, so, for the assessment part of it, in anger management, they don't necessarily focus on finding the roots of the anger, but more so the shortcomings that create the anger. The whole point of anger management is not to stop being angry because it is a natural emotion, but it's more so to understand the message behind the emotion and how to control it and express it uh, in a healthy way. So, a great assessment tool I found was a test. Um, this test can be completed online or on paper. It is called the Anger Management Map by the Conover Company. I thought this was a great way for the client to understand their triggers and their shortcomings. So, what this test does is it scales individuals based on 6 factors. And these 6 factors are the most common when controlling your anger. So, these 6 factors are the interpersonal assertion, empathy, stress management, interpersonal aggression, interpersonal deference, and change orientation. So, interpersonal assertion, it's a communication skill influenced by honesty, feelings, behaviors, and the appropriate expression of thoughts. So, essentially, what this means is being able to be assertive and express your needs, wants, feelings, in a comfortable and appropriate manner to people. Uh, a high level of interpersonal assertion would mean they can navigate through stressful situations and don't let others take advantage of them. So, in this test, low levels um, would be the negative, and the high levels of interpersonal assertion would be a positive. So, empathy is pretty self explanatory. It's the ability to accept and understand another individual's thoughts, feelings, and behaviors. So, uh, obviously, low levels would be room for improvement, and the high levels would be good. So, stress management, the ability to manage stress and anxiety in a positive way. Um, it is the ability to choose a healthy response to an overwhelming situation or event. So low levels of this would be something to improve on. High levels would be a good thing. So interpersonal aggression is a communication style within oneself. So this violates, dominates, overpowers someone's thoughts, feelings, and behaviors. This negatively affects um, the person's relationships. So low levels of this would be a negative effect on the person, or a positive effect, sorry. High levels would be a negative effect because you'd have high levels of aggression. So interpersonal deference is a personal communication style which is indirect, self-inhibiting, self-denying, ineffectual for accurate expression of thoughts, feelings, behaviors. So, interpersonal deference results in ineffective communication and also negative effects on one's relationships. So, once again, low levels of this would be a good thing. High levels would be a negative effect towards your anger. And then change orientation. I myself have problems with this one too. So it's the motivation, the readiness for change in a specific skill area. So this is one of the most important scales in anger management. So uh, low levels would be good, and high levels would be a negative effect towards your anger. So this is what the test online looks like. As you can see, the person had room for improvement on most of the things. Um, so, what this test does, it helps the client better understand their shortcomings so that they can get the right help in the areas that they need to focus on to better control their anger in a positive way, not to stop it, because these emotions are natural. Everyone feels anger.